We're recording, everyone. It's great to be here with you. I think we have until 3 o'clock to really dive into some work that I'm passionate about, and happy to have all of you on with us. Looks like we're up to a good group. Thank you for using the chat box. We'll use it for some engagement as we go along. So I always like to check that in the beginning. Another piece of technology that we'll be using for engagement as we go through is this poll EV. So can everyone please pull out, or either go on the computer you're on or pull out your phone and go to pollev.com/Nzinga Harris. My last name is Harrison, but I was character limited, so I had to stop at Harris 835. And answer this question for me. I'll know it's working because I'll see your answers popping up in real time. This is actually critically important for an activity we're going to do together closer to the end of our time, where we're actually going to walk through a racial equity readiness analysis for your organization. And so we need to make sure this is working. Your answers are completely and utterly anonymous. And so while we'll be able to see what percentage of people land in each of these categories, we won't actually be able to see your own individual answer or have that be attached to your name. So I'm talking, thank you, Corey. Corey dropped it into the chat box. Okay. I was like, I'm just going to keep talking for a little while until I can start to see answers coming in. So you can see how poll EV works. Looks like we have about a third administrators and 67% of people that are falling outside of direct care and administrative. Got it. And as more people put their answers in, this is exactly how you will see this live audience response working once we get to the next part of the talk, where we're going to use this, and we'll actually use it throughout. I like to use the chat box for engagement and this live audience response for a couple of reasons. One, we are all sitting in front of our screens, and I know your Outlook calendar is pinging. I know your Gmail is pinging. I know your Slack and instant messenger is pinging. So this is my way to compete for your attention. But also, it's great to just know who's in the audience and how our experiences are in common. And so that's how we'll be using this technology. So keep your chat box up and keep your poll EV ready to go. Thank you so much for your participation so far. Here's what we're going to do. These are my disclosures. Traditionally, I'm co-founder and equity owner of Eleanor Health. Non-traditionally, whenever I talk about racial equity, I give these disclosures because everything we'll talk about and the perspective that I give today is through my lens, having lived life as a Black woman, raised in Indiana, then at HBCU, Howard University, from the people who were on the line, down to Emory living in, up to Penn in Philadelphia for medical school, down to Emory living in the South. Every experience I've had, just like every experience you've had, is forming my lens as it's forming yours. And so I'm a Black woman. I grew up in Indiana. My father was commander of the local Black Panther militia when I was growing up. I have a Black husband, 2 Black sons. I'm a Black psychiatrist. I'm an activist. And you'll hear that throughout this time. Here's what I want us to do today. The very, very first thing we have to do as we're pursuing racial equity as any type of organization, especially as a healthcare organization, is to understand, accept, and have conviction around this concept that racism is trauma. So we'll go through how once we accept that racism is trauma, we can use our infrastructure, skills, expertise, and knowledge around trauma-informed systems and apply that to racism-informed systems so that we can be walking towards racial equity intentionally in our individual interactions, programmatic, organizational, and systemic design. We'll talk about the scope of the issue, and the issue that I'm talking about here is racial inequity. The scope that we're going to talk about is actually not among the people you're serving, but among the people who are serving, the people who work in our organizations. Because I often find as we're talking about racial equity and behavioral healthcare, other organizations, service organizations, we're thinking about the patients and we're not appreciating that. That's why I started with my disclosure, right? Like, the people who are doing the work have our own set of experiences that inform our ability to do this work. And so if we don't start with our staff and team members, we're missing the opportunity to drive even more impact for our patients and community members. Once we go through the scope of the issue, we're going to jump right into what we can do. So my goal when you leave here is not that you have awareness, which you will. That's great. We're going to do that. Not that you have a desire to be part of the change, which I hope you will. That's great. We're going to try to feed that. Not that you even know what needs to be done. We're definitely going to try to do that, but that you have the ability to go out and absolutely immediately put something into place as it relates to organizational design and planning towards racial equity. And then also that you understand how to reinforce the abilities that we're going to work on today. And so the way we're going to do that is by teaching you to use, we're going to do it in real time, this Race Matters Racial Equity Assessment for organizations. And we're going to go through a change management paradigm, which is called AdCar, which I actually just went through when I said awareness, desire, knowledge, abilities, and reinforcement. And so you'll see I built this time that we have together over the next about hour and a half, nested in that AdCar framework. And then finally, we're going to talk about how you develop a racial equity action plan for the organization, the work that you're doing, wherever you're doing that. Let me say, the chat box is for questions. So it is much more important to me that we give you content and information that you can immediately walk out of here and use than it is for me that we get through all of these slides. So please, 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 as you have questions, I'm keeping my eye on that chat box. Type your questions in the chat box so that we can do them in real time so that I can make sure you're getting what you need out of this time together. So that's what we're going to do. Here's the learning objectives. I already told you I want you to know how to put this work to work when you get out of here. So we're going to talk about how we use data to identify inequity, how a lot of times people won't look at data because they know that the performance is going to be poor. And we should all know that we have just begun truly developing kind of like systemic wide general public motivation around truly addressing racial inequity and all of the tentacles that it has, like in the last year. And so we don't expect any organization in general to be performing great on racial equity. So I don't want to look at it like we're looking at the data to find where we're failing. We're looking at the data to find where we have opportunity to improve. And if we can look at it through that lens, then we're motivated to look under every rock because we always want to be getting better. 2, we're going to go through a standardized tools. That's the Race Matters assessment to raise organizational awareness. We're going to describe and apply the AdCar model of organizational change to give you kind of a blueprint for once you have the data and once you've identified your opportunities, how do you address those? And then finally, going to put the two together, the Race Matters assessment and the AdCar change model, to develop an actionable plan towards equity for the organization where you're working. So let's start with what I said is the foundational concept for today. Racism is trauma. If you were in part 1, which I believe is recorded and available if you were not, we spent some time on the concept of weathering the physiological and psychological burden of racism as a trauma. And this is what it hinges on. Racism is a chronic, cumulative, ongoing trauma in the lives of Black people in the US. And when there are acute events like these I've listed below, people who are being killed by police, Breonna, Ahmaud, George, Rashard, those are acute traumas that overlay a chronic, ongoing trauma. And so if we can just accept on the baseline that racism is a chronic trauma in this country and acute on chronic trauma, that gives us the ability to apply a trauma-informed framework as we're working on racial equity. When we look at a trauma, then we know there are 3 E's, 4 R's, and 5 guiding principles of trauma-informed care, which is an approach that we use in the human service field. I believe probably everybody on this call is in the human service field. I hope you've heard of it. The 3 E's are just defining what a trauma is. So I think we can agree that racism is an event, a series of events, and a set of circumstances that Black people in this country experience as physically and emotionally harmful and life-threatening, and that those events and experiences have long-lasting adverse effects on the functioning mental, physical, social, emotional, and spiritual well-being of Black people in this country. If we can agree that racism meets the 3 E's of trauma, i.e. racism is trauma, then that empowers us to apply the 4 R's of trauma-informed care, realizing the widespread impact of racism, but also the potential paths to recovery from experiences of racism, recognizing the signs and symptoms of the effect of racism in clients, family, staff, others involved in our systems, responding by fully integrating knowledge about racism into our policies, procedures, and practices. And that's what we're going to spend time on today. And then this fourth one, which is hugely important, resisting re-traumatization. And I pulled this from a child-based slide, which is why it says of children. And I left it there because that's where we need to start for sure, as well as the adults who are caring for them. So that's whether that adult is our patient, whether that adult is our staff member, or whether that adult is ourselves, right? Trying to build systems that are not re-traumatizing people. We then can also apply the 5 principles of trauma-informed care. And as we're thinking about organizational readiness, I'm really harping on this point that this can not only point at the patients we're taking care of, we have to first start thinking about designing our systems, environments, policies, procedures for the safety, choice, collaboration, trustworthiness, and empowerment of our staff members, of ourselves, of the people on staff, because when we have staff who are working in a safe environment, who have choice, who are collaborating on how they're interacting with the system, who feel trust and who are empowered to have their voices be part of design, that puts people in a position to better serve our patients. And that leads us to a position to have better outcomes and reduce the mental health, physical health, overall disparities that we see for Black people in this country. And so to throw a statistic on that, this is in healthcare. 81% of engaged employees displayed a genuinely caring attitude towards patients, compared to only 38% of disengaged employees. And the way you keep employees engaged is by creating safe, trustworthy environments where their choice and autonomy is respected, their voices are empowered as part of collaboration on design. Okay? And so we want to make sure we're getting as close to this 81% of engaged employees who can be genuinely caring towards the people we're caring for, because that also turns into health outcomes. And so when we talk about the scope of the issue, what I want to talk about here is the scope of the issue of lack of safety at work for Black people. We know that racism is in all of the structures of this country. That's not an indictment, that's not a judgment, that's just a statement of fact. This country was built on slavery. Slavery was built on the idea that Black people don't have the same humanity as white people. And so when we see our occupational systems, criminal, legal system, economic system, healthcare, educational systems, that foundational value of Black people's value and humanity being less floats through all of the policies, procedures that we see in these systems, and results in that lack of sense of safety, that chronic, pervasive, invasive effect of racism on the lives of Black people in this country. So speaking specifically about occupational disparities, when we look at the racial ethnic distribution of healthcare workers, what I want to point out on this slide is that while 16% of all healthcare workers are Black, the majority of those are in the lower, least empowered roles in healthcare, 30%, 22%. When you get to the healthcare providers, which is physician, nurse practitioner, administrators, that falls to 10%. So when you're in an environment when only 1 out of 10 people in leadership whose voice crafts that system is having a similar race ethnic experience as you feel that, right? When we look at occupational disparities in wages, you can see here, Hispanic workers are faring even worse than Black workers, but this is with the exact same level of education. And so when we look at our systems, when our workers are coming and they know that, that decreases safety, that decreases choice, that decreases trustworthiness in your system. We're falling down on 3 out of those 5 trauma-informed principles, understanding that racism is trauma. When we look at workplace discrimination, race is the 3rd most common complaint. This is from EEOC, but trust and believe Black people are in that disability category as well as that retaliation category. And so not only is their lack of trust and collaboration and voices not being empowered, there's actual lack of safety through discrimination at work. This affects Black employees' abilities to be engaged, and we already saw that being engaged drives compassionate, caring, genuine care for our patients. The absence of that, which we already know our patients are experiencing because of stigma against mental health and substance use disorders, leads to the disparities that we see in behavioral health outcomes for African American people. Last slide on this, just to bring it home, when we break down who is being discriminated against at work, it's Black women, it's Black men at the higher end of that spectrum, right? That black bar and that white bar. People are being discriminated for gender, age, other combined. But when you look at the signal that comes out the strongest, it's race. And so we have to very intentionally be focusing on building a racism-informed system that creates that safety, choice, collaboration, trustworthiness, and empowerment for our staff so that we can then be rolling that to the people we're caring for who are receiving our care. And so with that scope of the issue, the question becomes then like, okay, what can we do, right? And so I want to get into what we can do. There's a lot. We can make individual interventions, departmental programmatic interventions, organizational, which is where we're going to spend our time today. All of these roll up to systemic changes. We spent a fair bit amount of time on individual and departmental interventions in the first part of this series, so definitely go back and watch it. We're going to spend our time today on organizational readiness. And so this is 1, 2, 3. First, you do an assessment based in data. And we're going to use the Race Matters. I'm going to teach you how to use that today. We're going to actually go through and do it with each other today. Once you have your data, that elucidates the opportunities you have and you formulate a plan. And the plan that you formulate is going to be, what am I going to act on? What am I going to do? How am I going to measure it to see if it's working, right? And then you move into change management with AdCar. How am I actually going to manage the change in attitude, behavior, and performance in this organization? Because a lot of times we jump straight to knowledge, telling people what they need to know, and we haven't assessed their awareness. We haven't assessed their desire to be part of the change that we're saying is going to happen. We forget to train them in the abilities that is necessary for them to carry out that knowledge. And then we don't build reinforcement to make sure that that change is sustained. And so we're going to go through each of those and some specific recommendations for how not to fall in those common pit holes that people fall into when trying to plan for organizational change management. So before I go any further, let me use this chat box and make sure y'all are not checking your email. Has anyone heard of this Race Matters assessment? It's a tool that's developed by the Annie E. Casey Foundation. I actually do not find it to be widely used at all, although I think it's brilliant and I try to get as many organizations as possible to use it. Oh, Margot said yes, no, most everybody else saying haven't heard of it, haven't heard of it. I hadn't heard of it either when I was first doing some racial equity action planning work. This is probably now about 8 or 9 years ago. And since I found it, I have been trying to get everybody to use it. It is so great. And so why should we use it? Because unequal opportunities and racial inequity are deeply embedded. Our country was built on racial inequity. So even though we've come generations light speed from where we were when there was slavery, those inequities are embedded and a lot of times not intentional. And so if we want to drive towards producing equitable opportunities, operations, and results, we have to introduce intention. This tool helps us introduce intention towards the goal of equity. It does that by raising organizational awareness, helping us focus our conversations on where our most opportunity for impact is, supports the development of action plans, and tracks organizational change. What I really, really like about Race Matters is you're going to get a score. And because a lot of this is a big elephant, right? Like racial equity is a big elephant that none of us will fully eat in our lifetimes. We will take bites out of this elephant. And a lot of times when you're just taking bites, it's hard to see your progress if that goal is racial equity. And so what this tool does is actually say, like, my goal is a higher score. And I'm walking towards racial equity and I can see my progress in real time. And when you see progress and success in real time, that motivates systems to keep at it, even though that true goal is really quite far away. And so how do you use it? This is a picture of the Race Matters assessment over on the right-hand side. I have not found an online copy of this. And that's actually, I mean, like where you can like actually put it in like a calculator. And that's actually fine because the way you use Race Matters is you need to be digging through policies, procedures, and data. So you wouldn't just sit down at a computer and answer through all of these questions anyway. That is what we're going to do together right now, is go through and do a Race Matters assessment just based on what you think. And we're going to get a gestalt and we're going to have an idea of where we are. When you use this tool for your organization, it will not be just what I think. It will be based on data. It will be you actually looking at your policies and procedures and coming to an answer for the survey so that you get a real score that guides you. You do the answers. There are two sections: staff competencies and organizational operations. Staff competencies has 9 questions. Organizational operations has 10. The total score, you add it up, and then it gives you this guidance at the end. If your total score is less than 20, your organization needs to be working on developing intention. 20 to 29, you have the intention. Now you need to build staff and organizational capacity to drive that intention forward into action. 30 to 39, you are doing the dang thing. So we're just going to be fine tuning. And 40 to 49, you have reached expert level and we need you spreading the word. Like they say, the 12th step to keep it, you got to give it away, right? And so what I love about this also is once you get those scores and it tells you next steps, the NEEKC Foundation has Race Matter tools that are benchmarked specifically to that phase of development to help drive forward your planning and action. So let's jump right into this, okay? This is going to be poll EV. So pull up your poll EVs and get ready. We're going to go through each one of these questions, and I want you to think about the smallest unit that you're responsible for. So if you're a direct care provider, the team that you work on, if you're a manager, your team that reports directly to you, if you're an executive, your whole company, if you're on the board of directors, right? Like I want you to think of the smallest unit that you are responsible for and answer these questions for that unit. I want you to keep track of your scores as we go. So by the time we get to the end, we're going to have, for the group of us who are on here, we're going to have an aggregate score of what our Race Matters racial equity readiness score is. I am also going to keep track of our aggregate score. I'm going to just take the one that's the most common to each answer, and we'll get our group score at the end. So here we go, staff competencies, and we're going to go through these quick because I just want your quick reaction. Remember, that's not how you do this tool in real life. Staff are trained and knowledgeable at the 101 level, so beginner knowledge about the range of barriers to equal opportunity and the depth of embedded racial inequities, how they are produced, and how they can be reduced. Overwhelmingly, our score on number 1 is some. Some of our staff are knowledgeable at the 101 level. A couple of you, 21% are further ahead, almost all, and 5% of us are struggling on this with none of our staff really having 101 knowledge. Number 2, staff have a deep level. So number 1 was beginner level of knowledge. Number 2 is a deep level of understanding about those barriers to opportunity and embedded racial inequities in their special area of focus. So if they're doing child and adolescent behavioral health, they have a deep level of understanding there. If they're doing substance use disorder care, a deep level there. If they're doing trauma and EMDR, a deep level there. Okay, about 50-50, but looks like some is edging out, almost all for about 5% of us. Got it. Number 3, staff are comfortable and competent about discussing issues of barriers to opportunity and embedded racial inequities with relevant individuals and groups. This is very, very, very often where we get our first 0. I see 0 and 1 are definitely competing with each other. Looks like 1 is gonna win out. Sometimes staff are comfortable and competent. That's pretty close though, okay, but we're gonna give it a 1. Oh, sometimes it's gaining some steam, okay. Almost always for about 5% and always for about 5%. Number 4, staff exhibit cultural competence in interactions with diverse groups. Some. Almost all. Okay, and you know what? Because there was a lot of intention starting about 2 decades ago poured into cultural competence, right? So that's why we see 39% with almost all, whereas the highest we saw on almost all for questions 1, 2, and 3 was about 5%. This tells us that we can make a difference when we apply intention. So just like almost all is 46% today on cultural competence, we would like to see that on comfort having the conversation, deep knowledge in their expertise area, right? Number 5, staff disaggregate data by race in all, not some, all analyses. I knew if I saw almost always, that was going to be not the truth. All analyses, rarely. So do you see how Race Matters has already helped us identify our number 1 opportunity, disaggregating data by race in all analyses? Number 6, a racial equity analysis is applied to policy issues. So when you're writing a new policy or your organization is rolling out a new policy, not a diversity policy, not an equity and inclusion policy, any policy, a racial equity analysis has been applied to it. This is very common area of opportunity, right? So we got a 0 on that one as well. Number 7, number 6 was about policy. Number 7 is about practice issues. A racial equity analysis is applied to practice issues. Looks like we have, okay, I was about to say even more opportunity here, but it's about the same. Okay, rarely, sometimes it's given rarely a run for its money. Let me give it another minute. We might get a 1 on this one. 1. 2 more in this section. Number 8, written materials for your organization, your smallest area of responsibility, team, department, functional area. Written materials reflect a knowledge and understanding of barriers to opportunity. So, last question in this section, number 9. Staff can articulate the cost And that's just not financial. This is like financial costs, opportunity costs, retention, health disparities, clinical outcomes, people quitting, to staff turnover, legal exposure, discrimination and complaints, okay? Your staff can articulate the cost of failing to address barriers to opportunity and embedded racial inequities. So, all righty, that was staff competencies. So you see how we just answered these according to like, I think some, I think most, I think nobody, right? What you would actually do then is do a survey and have your staff try to articulate the cost of failing. What are the costs, excuse me, what are the costs of failing to address barriers? And then you would see the responses to that survey and then score none, some, almost all, or all of your people could articulate those, right? You would look at your written materials and see if none, some, almost all, or all of your written materials are reflecting a knowledge and understanding of barriers to opportunity. You would look at your practice issues and the documentation of when you're addressing practice issues and see if rarely or sometimes you're applying a racial equity analysis. So you do this in a very systematic, disciplined way, and you get to that score at the bottom. Let's go on to organizational operations. Number one, removing barriers to opportunity and disparity/disproportionality reduction are explicit goals of the work and articulated in your mission or vision statements. No, an opportunity. Number two, your unit that you're scoring for right now has an internal team that guides the ongoing work of removing barriers to opportunity and reducing racial disparity and disproportionality. This might be our first two. Let me give it a minute because one is giving two some, oh, come on. Well, I guess I got to score this 1.5. 1. That was exciting. That's our strongest performance so far. So this means we're dedicating resources to it. So this is awesome. That's like the first step, right? The organization's goals of reducing barriers to opportunity and racial disparities, disproportionality are reflected in resource allocations. Resources being people, time, and money. So a lot of times we'll give it a person, but we don't give that person a budget. Or we give it a person, but we don't give that person dedicated time. Moving in that direction, which is always excellent. Number 4, investments promote capacity building and asset building for people and communities of color. This is where healthcare frequently falls down because we think of it as outside of our scope to capacity build and asset build or to prepare people to do that for themselves, when in reality, it is 100% within our scope. So rarely and sometimes are tied here. I'm gonna give it a minute, see one of them. See, when I give it a minute, the answer comes. I gave it 2 minutes and then it went back to a tie. I'm gonna err on the side of benevolence and give it sometimes. I'm gonna give it a 1, okay? Number 6. Oh, sorry. Number 5. Results of investments show opportunity for all and a reduction in racial disparities, disproportionality. Sometimes. 63% of you say sometimes we're getting return on investment. 38% say rarely. We're investing, but we're not seeing the results of it. This is a beautiful opportunity. That means you somehow need to change what, where, how, when, why, you're investing, because you always want to be able to see the results. Or it also may mean you have the definition of results way out there. And if we could bring that definition sooner, we would be able to see that, yes, we are making an impact, we are making a difference, which is very important, because when systems invest and don't see return on investment, systems stop investing. And we cannot afford for systems to stop investing in this work. And so we have to show success and movement. The organization has a deliberate plan to develop and promote the leadership of staff of color. A deliberate plan is written down. This is our second big opportunity. Actually, fourth. This is our fourth 0. Number 7, the organization has regular trainings and discussions at the staff and/or board levels about removing barriers to opportunity and reducing racial disparities to disproportionality, both internally and externally. So we have some companies that have a big external face, but are doing less work internally. We have some that have a big internal face, but are not pointing that work to the public. And we really need to be going in both directions. All right, moving in that direction. Number 8, 3 more to go. The organization regularly assesses workforce composition by race, ethnicity, and develops, implements strategies for increasing diversity at all levels. So like that graph I showed you about total percent of healthcare workers and how that grew to 33 and plus percent in the lower compensated, less empowered voices roles, and fell to 10% in the higher compensated. That's like, we're looking at that data on a regular cadence and implementing a strategy. Moving in that direction. Number 9, the environment of the organization is multicultural. People, food, art, holidays, activities, decorations. I'm surprised to get no. This is usually one, and no and yes are competing. So that's interesting, because this is pretty diametric, right? Most of our scores have been 1s. We're moving in that direction, but this one is like no and yes. And so I see this as an opportunity also, even though I'm going to put a 2 here. I'm sorry, I'm going to put a no here. 0 was the biggest one. And then finally, number 10, the organization has a mechanism in place to address complaints about barriers to opportunity and racial inequities in the workplace. This one is also diametric. Okay, we're getting a little mix in there. Ooh, I'm gonna give it a minute. Is it gonna be a 0 or is it gonna be a 2? Pretty diametric. No, 0. Okay. So when I add up our scores, now here's what I want you to do. While I'm adding up the total score, I want you to add up the score for what you wrote down, okay? I'm gonna give you a minute. Our aggregate score as a whole group is 13. So this tells us that we're at the state where we have to become intentional. Becoming intentional means making an emphasis on racially equitable results explicit in your unit or organization's mission statement, right? It is first making the commitment. And then once you make that commitment, starting your data collection to evaluate your performance with an emphasis on this as a criterion. So we make the commitment to racially equitable results as part of our mission statement. And now we're going to start collecting the data so that we can measure our performance, identify our opportunities, and move forward with an emphasis on racial equity as a criterion for everything we do. Okay, and you can see Race Matters has a lot of tools over there to help you through that. For this one, oh man, I meant to put a slide in here. I'm sorry, I missed it. I meant to put a slide in here that said what was your score? So let me see if I can actually, I need one with 4 choices. Okay, here's what we're gonna try to do. We're gonna use this one. I'm gonna clear these answers out. If your score was less than 20, I want you to use a 0. If your score was 20 to 29, I want you to use 1. If your score was 30 to 39, I want you to use 2. And if your score was 40 or greater, I want you to use 3. Thanks, y'all. More than one way to skin this cat. So what we can see is overwhelmingly, and you're already demonstrating your intention because you're here today on this call, overwhelmingly 2 out of 3 of us on this call are at the place where we need to develop intention. And so for the rest of the talk, I want to talk through how we develop intention. But as we drop into this AdCar model, even those of you who are in the second bunch, which is like developing your capacity and your organizational and staff's capacity to move towards racial equity, this will certainly apply. For the 6% of you who are fine tuning, and for the 6% of you who should be trumpeting this to the world, I hope you are trumpeting this to the world. And as we move through, please use the chat box, ask your questions, put your guidance and comments and things that you've learned in there so that we can all be learning from each other. Before I move on to AdCar, any feedback on that exercise? Did it tell you anything you didn't know? Did it reinforce what you knew? Did it help you gain an idea of like, okay, I knew we needed to do 30 things, but these are the 2 I'm going to start with? Just give me some feedback in the box. Margot says it reinforced. Y'all see me try to get my water intake in. Love that it helped narrow it down because it takes this big elephant and gives you a small bite to taste, right? Lauren says, how do we get access to this model? I'm going to ask Corey to tell us that when, I don't know, Corey, if you want to pop on now or if you want to pop on at the end. I'm definitely going to share this slide deck. But you can also, this model is by Prosci, Prosci. If you Google it, they have tons of beautiful resources for the AdCar model. For the Race Matters assessment, if you Google Annie E. Casey, Race Matters, you'll find all of the resources there. Reinforce, good ideas for first step, reinforce, and new things, help narrow it down. Awesome. That's exactly what I hoped it would do for you. Thinking about this AdCar model, we got about 40 minutes left, which is perfect. In behavioral health, we all have this concept of the stages of change. We use it in substance use disorders for sure, and any other behavioral change that we're trying to help support people through. And it's concept that there are, usually we say 5 stages, but this one has 6, which I thought was appropriate, so I left it there. This is Prochaska and Di Clemente, pre-contemplation. There's a problem, but I don't consider it a problem. I'm not willing to change. I'm not considering change, or I'm not able to change, right? Before contemplating a change, pre-contemplation. And when we have people who are in pre-contemplation, our goal is to raise their awareness that there actually is an issue around which a change is needed. Okay, contemplation. I see that I might need to make a change here, but I'm not sure I'm ready to make a change. And our primary task is to help that individual resolve that ambivalence and help choose a change that they can be successful at, i.e., that Race Matters assessment that we just did. Then determination is the stage that is not usually there, but I was like, I like it, so I kept it in. The person has committed to changing. Still considering what to do though, right? But like, you know what? I commit to be part of this change. Now I just need help identifying what strategies I'm going to use. I think that's probably where many of us on this call are. You're here today because you're committed to being part of the solution and trying to figure out what strategies to use to do that. Then you're like, all right, I got my strategies, I planned it out, I'm ready, action. And you move into the action of making the change. And our primary task here is to help reinforce those actions, eliminate barriers to those actions, but also to be feeding people successes. Like, man, you are doing the dang thing. You are getting the job done. This is amazing. And what I find about racial equity action work is sometimes we set that definition of success so far out there that we miss that crucial intervention at this stage. And that pushes systems and people back to earlier stages. Number 5, maintenance. Okay, we made a change. We are rocking and rolling. How do we sustain this? And then finally, recurrence is when there is a relapse to the behavior that was in place before that change. And we address that by coping with the consequences and determining what to do next. And so you all already know these stages of change. It is literally the exact same thing in different words for this organizational change model called AdCar. Okay? A, awareness for the need for change is the first stage. That's moving systems and organizations from pre-contemplation to contemplation. You know, the big, huge leap we made in the last year and a half after all of us watched George Floyd get murdered on camera was an awareness leap. It was an awareness leap, a collective opening of eyes, right? Then once you have people like, oh man, I'm aware that a change needs to happen, just being aware that a change needs to happen doesn't mean that I agree to be part of the change or support the change. And that's where the D for desire comes in, right? So just because I'm in contemplation doesn't mean I'm going to move to preparation or action. And so desire to support the change. And then I'm like, you know what? I got to be part of the solution here. But what do I actually need to do? That's knowledge. That's giving the tools, helping define the strategies. That's a lot of what we're doing here today, right? And then like, oh, okay, I know what needs to happen, but I don't actually know how to do that. That's abilities. And that's where you get into training. And where I find organizations often skip over steps is that they will make the organization aware of what needs to change. Skip over desire. Not even thinking about whether people are willing to support that change or not, just like push it down as an edict, and then jump straight into webinars. Knowledge, knowledge, knowledge. And so I know what you want me to do, but I don't necessarily know how to do that. And then no reinforcement to make it stick. So how do we make this change sustainable, right? That maintenance phase on the Prochaska and DiClemente stages of change. So let's drop into this a little bit deeper. Awareness. What are we actually talking about in the AdCar model when we say awareness? Is a person's understanding of the nature of the change. Has 2 components. Why the change is being made. We often communicate that. Number 2, the risk of not changing. We often don't communicate that. The reason we have to change now because the risk of not changing is. And you saw that question in the Race Matters assessment where it was, can your staff articulate the costs of disproportionality and disparities? Can your staff articulate the risk of not making this change right now? And when you're working on developing people's awareness, this has to include information about the internal drivers that created the need for this change, our own policies and procedures. This is how we've been contributing. The external drivers that created the need for the change, structural racism, cultural beliefs, the fact that this country is built on slavery. And number 2, very importantly, what's in it for me? So sometimes people will get offended by the idea that we have to develop awareness for the individual by telling them how this change benefits them, but that is just human nature, right? So we can say we want racial equity and you feel like that should be enough. People will be like, you're right, we want it. But there are threats perceived in racial equity. And so we have to look at what's in it for me to understand and help that person understand why racial equity benefits them, even if they're not a Black person. The first goal is defined as awareness of the need for change, not just awareness that a change is happening. And so as you're designing your racial equity action plans at your workplace in your life, you want to start with evaluating the awareness of the people that you're going to ask to navigate this change. Do they understand why the change is being made? Can they articulate the risk of not changing? And the reason it's so important to really pour intention and investment into the awareness stage of organizational change is because lack of awareness is the primary source of employee resistance to change. Numero uno. And it is driven by failure to communicate the details of the change, and employees can't answer what's in it for me. They have to be able to answer what's in it for me. So say you lay out, say you answered on race matters that no, we don't have any intentional plan for promotion for people of color. And then you have your people who are not Black saying like, well, that's taking away opportunities from me because there are only a finite number of opportunities and you're going to preferentially give it to Black people. What's in it for me is this is the demographic makeup of our organization. When we have inequity, people leave. This is our turnover rate. When our turnover rate is this high, that increases your work burden because you have to now make up for this. So what's in it for you is more stability, and we're actually going to retain your ability for upward mobility because you're going to be doing your job instead of everybody's job because people are leaving. That's how you address a what's in it for me, right? When awareness is overlooked or ignored, you get increased resistance. The progress is slow. You get reduced return on investment. And the fourth bullet point here is when systems don't get return on their investments, they stop investing. And that would be a fatal error of this work. Here we go. Pull out your poll EV. So thinking about the unit or organization, thanks, Margot, I appreciated you. When you think about the organization that you answer the Race Matters assessment for, what do you think is the most likely barrier your department will face against building awareness? Very, very common. How the problems are perceived, unclear reason for change. Okay. And so when you're designing your equity action plan, you want to pour a special intention into how you're describing the problems because you want to influence the perception of the change that you're going to ask people to make. And you want to be excruciatingly clear what is the reason for the change. And a lot of times the mistake that we make, the reason for the change is 100% nested in the benefit of the patients that we serve. Don't forget your staff. If you are asking your staff to change, you have to tell your staff what's in it for them. The number one reason for the change has to be their safety, empowerment, trustworthiness, collaboration, choice, right? And when we provide that for you, this is how it's going to benefit our patients. 81% of you are going to be able to approach them with care and compassion. Desire. Okay, so the A was awareness, D is desire. What is desire as related to the AdCar model? It's the willingness to support and engage in a change. Okay, it is the commitment. I will be part of this change. That's when an individual genuinely says that. That's when you have achieved desire. Ultimately, desire is a personal choice. And what influences us to develop the desire to say, I will be part of this change, depends on what the change is, so the nature of the change, and also depends on my personal circumstances. I might not have the bandwidth, although it is extremely important. I don't have the emotional bandwidth. I don't have the cognitive space. I don't have the time to be part of this change. I won't resist, but I'm not going to actively be part of it. Or my understanding and perception of the problem actually seems like this change is going to make my personal circumstances worse. I'm not going to be part of that. And so when you're designing for desire phase of organizational change management, you have to know literally down to the individual in your organization that they understand the nature of the change and what are their personal circumstances that affect their ability to commit to be part of the change or not. Because once you understand those, you can start designing to those barriers to try to remove the barriers out of the way in partnership, right? So that they can then, yes, make the commitment to be part of the change. Focusing on desire is so critically important because when you don't understand the underlying factors that are barriers to a person's level of desire, you can't plan for it, and you can't respond to the behaviors that employees express when they're confronted with a change. And so this comes back to these four things: very clearly articulating the nature of the change and what's in it for me, very clearly articulating the organizational context for the change. So that's where we're usually very good. This is going to be good for the organization because you have to start with number one. This is going to be good for you because, and if it's good for you, that's going to make it good for the organization. We have to be able to get to an employee's personal situation. So a lot of times what we do is like push these initiatives out from the top level, when what we really need to do is start with our managers of the smallest unit. That's why I had you conceptualize the Race Matters assessment that way, because somebody has 5, 10, 20 direct reports that they can actually have an individual conversation with to start understanding these barriers to desire. The same way we do in contemplation. We have to look at personal values and motivators. So I started out with my disclaimers, like my whole life perspective is bringing me to this talk that I'm giving you today. Every single person that works for you has their whole life perspective driving their personal values and motivators. And when you're recommending a change that feels in conflict with personal values and motivators, that person is not going to get on board. So understand what their personal values and motivators are. And there is almost always a way with intention and creativity to language or racial equity action change in concert with a person's values and motivators. In those small instances when there's not a way, then you have a decision to make. Is this a good fit? So, is your manager, or languaged another way, are you sufficiently equipped to help your team develop the desire for racial equity? And what that's really asking is, are you sufficiently equipped to have the conversations to understand their personal values and motivators to identify any barriers so that you can intentionally plan for those in your communication about the change? So this is a big opportunity, right? And you're here because you're trying to equip yourself with this. But what I would say is, if you don't feel like you're sufficiently equipped, or if your manager is not sufficiently equipped to have that conversation with the team, that has to be the first step. Because when you come with a change that is this big and you don't feel equipped to have the conversation, then credibility becomes an issue. And when credibility becomes an issue, you get resistance to the change. That undermines a sense of safety, that undermines that sense of trustworthiness and those 5 principles of the racism-informed system. So knowledge. Okay, so we got people aware. People are like, I'm ready to be part of this change. What? Knowledge. What information, training, and education do I need to know so that I know how to do this change, right? The knowledge needs to include behaviors that I need to know that I need to do, skills that I need to have, processes that I need to know how to run, tools and systems that I need to know how to use, roles and responsibilities, mine as well as the people around me, towards racial equity action planning. Okay? The reason it is so important, successful knowledge building, because people can be aware and have all of the desire, and you say, go out and make the change. And when you don't know what change you're actually trying to make, you're investing time, you're investing money, you're investing people, and you're not getting a return on your investment because your efforts are not effective, right? And so successful knowledge building requires knowledge on how to change, but it also requires knowledge on, we're here, our goal is to be here, how do we operate in the transition? Training and education on the skills and behaviors needed to support it, okay? So I need to know, here is where I am. Here's how I'm going to perform effectively in the future state. Here's how I make it to that point. A lot of times we miss that transition step. We just say, here's where we are. Here's the change we're making effective September 1st. Y'all know we do that. One of the biggest strategies for building knowledge is actually informal knowledge building. So we usually use a lot of formal knowledge building, webinars, focus groups, handouts, trainings, right? When there are a lot of informal activities that actually help spread knowledge, help increase awareness, help drive desire peer to peer, like the watering hole, right? And so let's use this slide to brainstorm some informal activities. So not that you're sitting people in front of an instructor, but something more informal that still gives them a piece of knowledge around racial equity. I'll start with an example, watching a movie together and just having a discussion after the movie. What are other things? Because the thing about informal also is that it increases a sense of safety when people feel like we're just hanging out and learning at the same time, as opposed to you have to learn this and take a test on it. What are other informal activities you've used successfully, you've seen other organizations use, that could help to build knowledge around racial equity? Yes, definitely. Oh, I love a board game. That's awesome. Small group discussions. Yes, including it in supervision. Amazing. Oh, putting notes on the whiteboard. I love that. Book discussion. I love the quotes on the whiteboard. That is actually, and that's like some subliminal. I'm going to do that. Reading articles, books, movies, guest speakers, lecturers, podcasts, right? Icebreakers. Yes, 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 yes. Oh, I see some over here. Lauren said having a retreat, definitely. Eating lunch together, getting to know other people. Going back to that question that I got a little bit surprised by on the race matters, having just multicultural environment, decorations, pamphlets, written materials. Where I come from, poem writing, I absolutely love that. Peer groups. Okay, so like these are a lot of ideas. Incorporate them because you want to have a balance. We tend to have like 95% formal and 5% informal. Informal is very impactful. If I made up a ratio for you, I would be making it up. So I'll refrain from that. But all of these are incredible, incredible ideas. So then we move from knowledge to abilities. And Prasi uses this great example, which I love. If you pull down their documentation, and it says, you go to the basketball game and they pull that unsuspecting person out of the audience and put them on half court, and they say, all you have to do is shoot that ball into the hoop, and we'll give you $50,000. Now, does that person know what they have to do? Yes. All they have to do is shoot that ball into the hoop to get $50,000. Do they have the ability to do that? Probably not. The insurance company is banking on definitely not, right? Because they know it's unlikely they're going to have to pay out that 50K. And so a lot of times this is what we do to people in our organizations. We put them on the half court line and say, all you have to do is shoot the ball in the net. And I'm going to hold you accountable for that. But we don't teach them or support the development of the ability to turn that knowledge into action. Can you tangibly apply and demonstrate the intellectual understanding in a real world environment? And so we have to pour a lot of intention into developing the abilities of our people, because there's a distinct difference between knowing how to do something and being able to do it. So all you have to do is stand there, get the right arc on the ball, hold your posture, take a look. I can tell you everything that needs to happen for me to get that ball in that basket, but I am probably not walking home with $50,000 today, right? The gap between knowledge and ability can be huge. Book smarts, they say book smarts and street smarts. We need to give our people book smarts and street smarts. And then finally, the knowledge of how to change by itself is usually insufficient to actually change that into behavior. And as people see themselves not doing well and racial equity action work, you get discouraged, you lose the motivation, you slide back in those stages of change back to, you know what, it wasn't really that big of a problem anyway. I don't have to continue to pour intention and effort into it. And so you want to really err on the side of over developing people's abilities in this area. And it starts with the very, very simplest thing, which is like how to have the conversation. And so if you're thinking about the biggest obstacle to racial equity as it comes to developing abilities for people, what do you think is the obstacle you're most likely to encounter when you're trying to help people develop the ability? Is it psychological blocks against a change toward racial equity? Is it physical or intellectual limitations, like they literally just cannot do it? Our time and priorities, there's not enough time to invest in this, not enough resources. Psychologically, people have blocks against this change. Force of habit, which we are all creatures of habit, right? So we're trying to make a change, but the force of habit is driving us backwards. Yep, this is the order I almost always see it go in. Almost always force of habit, number one. Time and priorities and availability of resources usually toggle back and forth, second and third. And so if we know that up front, we plan for that. How are we going to reinforce new habit? How are we going to dedicate time? How are we going to designate this as a priority? And people know it's a priority because we gave it people, time, and money, right? Like thinking of it this way gives us the opportunity to plan ahead for those headwinds so that they don't knock our work off of its feet. And then finally, reinforcement. So we went through awareness, desire, knowledge, abilities. And if you see the way I tried to design this talk, we started with awareness, racism as a trauma, went through the scope of the issue. That's awareness. That is defining the data that tells us what change we need to make. Desire, I tried to develop that at the same time we were going through knowledge, at the same time we were going through abilities with that race matters assessment, right? Like I had you keep your own score because I wanted you to develop the desire, like, oh, this score is lower than I want it to be. I'm going to be part of this change. And I was developing the knowledge through the questions that were being asked and the ability to use that tool instead of just showing it to you. I had us actually walk through and use it so that you have one use under your belt. That is an intentional. That's the way I designed this training to be AdCar focused. And so then we get into reinforcement, which is what? Reinforcement represents the internal and external factors that serve to make your work sustainable. It has to be intentional. So this is recognition, this is rewards, this is celebrations, this is carrots and sticks, okay? This is also a person's internal satisfaction with their achievement. And so I know I keep going back to this idea that we have to drive this work with a sense of accomplishment, because if you don't drive this work with a sense of accomplishment and success, the work becomes too hard to do and you get burned out on it. So every single chance you find to reinforce, to trumpet a success, you have to find that as part of your reinforcement strategy. And so I was doing some racial equity action planning work with an organization last month, and they had a survey that they had been using with their people. And so they had a change. It was a safety measure. I forget what the question was specifically, but let's say it was like, do you feel safe talking to your manager about race issues? And they had a change from 20-ish% of people said yes to 30% of people said yes. The change was not statistically significant. So they had discounted it. They weren't even going to report it. A statistically significant change based on the number of people that they had interviewed would have been a jump from 20% to 40%. And so after we did this, they said, could we actually see that as a success? And I was like, yes. Because the way you put it out to the masses is, man, when we did this 6 months ago, only 20% of you felt safe. Now 30% of you feel safe. Our goal for statistical significance is for it to be 40%, and we're halfway there. You see how that's a huge difference between, oh, this is not significant, and it is a step in the right direction, and pouring lots of positive reinforcement, because then that encourages people and nourishes people to be able to take the next step. The reason reinforcement is so important is because we're humans and change is hard, right? Like, we didn't make a change. It's even harder to sustain that change over the long term. And I already said this goal, racial equity, that is a long-term goal. So our human nature, especially when we get under stress, is to revert to what we know. Y'all put habits as number one, right? Physiologically, we are wired to return to our most comfortable and most familiar state. We have been taught in this country that talking about race is scary and leads to bad things. And so physiologically, we have to help people overcome that with a sense of positivity, reinforcement, and a success frame, a frame of success and progress. Effective reinforcement does three things for us: sustains the change and helps us prevent slipping back, builds our momentum so that we can continue to transition from our current state to the future state where we want to be, and it creates a history of success that increases our agility for future changes that are needed. The more we believe in our ability to successfully change, the more we're able to successfully change. And so as you're doing your racial equity work, it is very easy to get discouraged, like things are not changing fast enough. Trust me, I feel it. I feel it. I have to give myself this own talk periodically. Look at where we came from. Use a quantifiable measure like the Race Matters organizational assessment, because you might still be less than 20, but you might have gone from a score of 5 to a score of 16, and that is success. So what reinforcement tactics are y'all currently using at your place of work? Reinforcing success and progress for racial equity. Do you celebrate and recognize people who do something awesome, even if it's small? Even if they say, I felt like that was a microaggression, you reward them for starting the conversation? Are you getting feedback from your employees? Are you sending feedback to your employees? Are you auditing and doing performance management? So everybody has to do implicit bias training every 6 months and yours isn't done yet? Are you holding people accountable? Okay. So all of these are great reinforcement tactics. And what's important is that as you're designing, before you even launch, before you even communicate to the people that change is a coming, you need to already know and have your reinforcement strategies along with your awareness, desire, knowledge, abilities, reinforcement strategies already designed and planned out so that you can communicate it to people, right? Like every time I hear about somebody having a conversation that was a little uncomfortable, this is what the recognition is going to be. Every once a month, we're going to have a celebration where we recognize those people who have gone above and beyond for racial equity. Here's what our data was. Here's what our data is. We're going to be giving you feedback every quarter, right? And in our last 10 minutes, how do we put it all together? So I said I wanted you all to leave here with the ability to start executing on a racial equity action plan. And so here are the steps. Number one, take the Race Matters organizational assessment for real. Or even if you just start with the one that you did from your gut today, but I really want you to take it for real. I want you to look at policies and procedures. I want you to look at the data that you have. I want you to look at the surveys that you have. I want you to have focus groups. I want you to have individual conversations. It should take a while. Even if you just start with the gestalt, the gut feeling that you had today. Filter your staff competencies and filter your organizational operations by your lowest score. Okay? So if I take us back to what our lowest score was, if we were going to do a racial equity action plan from here, Number 5, 1, 2, 3, 4, 5. Results of investments show opportunity for all and a reduction in racial disparities. We rated ourselves a 0 on this. This is an opportunity to take a look at our investments. Are we investing in the wrong places? Are we not adequately investing? Number 6, we have a deliberate plan to develop and promote leadership of staff of color. We gave ourselves a 0. Our action plan is going to be to develop a deliberate plan, right? That was in staff competencies. If we look in organizational competencies, oops, sorry, that was wrong. Those were organizational competencies. So let me tell you the right answer was number 1. Removing barriers are explicit goals and articulated in our mission vision. We gave ourselves a 0. Let's revise our mission vision and include opportunity and disparity, disproportionality reduction as an explicit goal. And it was number 6, which I had right. The organization has a deliberate plan. If we look under staff competencies, it was 5 and 6. We disaggregate data by race in all analyses. Action plan. We gave ourselves a 0 here. Action plan. We're going to start disaggregating all of our data by race. Whatever data we have. Number 6, we gave ourselves a 0. A racial equity analysis is applied to policy issues. Every single policy we look at to revise, every single policy we look at to write, we're going to apply a racial equity analysis before we finalize that policy. That's our action plan. Okay? So once you do your Race Matters assessment, then you filter by your lowest scores. And then you choose 1. We don't need to eat this whole elephant. Our stomachs will be aching. Okay? Choose 1. 1 staff competency, 1 organizational operation. Practice developing an AdCar plan around it. So 1 staff competency. How are we going to measure awareness? How are we going to clearly articulate the need for change and the risk of not changing now? How are we going to evaluate our people's desire to support the change? How are we going to help them understand what's in it for them and move towards committing to be part of the change? How are we going to tell them what needs to change? How are we going to know what knowledge is needed? And how are we going to train them in the ability to actually make that change informally and formally? And finally, how are we going to reinforce this? How are we going to make this 1 staff competency be a sustainable change and this 1 organizational operation be a sustainable change? Develop your AdCar plan, put it into action, throw a PDSA cycle on it, plan, do, study, act. Oh, that didn't go exactly how we thought it would. Revise, measure your success, right? Watch yourself move from a 0 to a 1. Watch yourself move from a 1 to a 2. Have a loud, out, explicit celebration every time it happens. And with that, this is the reason I do this work. This is my family. If you can believe, that's my youngest son on the left, though he is the tallest, 14. My niece in the middle, my oldest son, 16, and my husband there on the right. Any questions?